In real emergencies, people panic. When someone collapses, bleeds heavily, or can't breathe, it feels like chaos. But even in those moments, one calm, simple action can save a life. That's why I'll show you emergency medical steps that actually save lives in real situations like cardiac arrest or severe bleeding. The first tip is cardiopulmonary resuscitation, CPR. This is one of the most critical life-saving actions you can do when a person's heart suddenly stops. You should perform CPR if the person is unconscious, not breathing, or only gasping, and shows no signs of circulation like a pulse. It's important to act fast because around 70% of sudden cardiac arrests happen at home or in public places, often with no medical professional nearby. In this case, CPR becomes crucial because when done immediately, it can increase the person's survival rate by 2 to 3 times. Without CPR, the chance of survival drops by 10% every minute, so every second counts. How to perform CPR correctly? First, make sure the person is lying flat on their back on a firm surface. Place the heel of your hand on the center of the chest, right between the nipples. Put your other hand on top and lock your elbows. Push hard and fast. Your compression should be 5 to 6 centimeters deep, with a rhythm of 100 to 120 compressions per minute, similar to the beat of the song Stayin Alive. If you are trained, you should do full CPR, that means 30 chest compressions followed by 2 rescue breaths. To give breaths, tilt the person's head back, pinch their nose shut, and breathe into their mouth. The chest should visibly rise. Then immediately return to chest compressions and keep repeating this cycle. If you are not trained, don't attempt rescue breaths. Focus on hands-only CPR, performing continuous chest compressions until professional help arrives or the person shows signs of recovery, like breathing or movement. Common mistakes to avoid. Pressing too lightly, this fails to pump enough blood to the brain. Pressing too slowly or with irregular rhythm reduces effectiveness. Delaying CPR after recognizing cardiac arrest, every minute matters. You should stop CPR only if trained personnel arrive and take over. The person starts breathing or shows clear signs of life. Or you become too exhausted to continue. The idea behind cardiopulmonary resuscitation is simple. When we do chest compressions, we indirectly compress the heart, which sits right behind the breastbone. This forces blood out of the heart chambers into the arteries. Even though this circulation is weak, around 20 to 30% of normal blood flow, it's enough to keep some oxygen reaching the brain. That's critical because without oxygen, the brain starts to die within about 5 minutes. The heart itself also needs minimal coronary circulation during CPR, which increases the chance of the heart restarting on its own. When you give rescue breaths, you provide the person with air that contains around 16 to 17% oxygen. Normally, air contains 21%, but even this lower amount is still helpful. It improves blood oxygen levels and helps support the vital organs during CPR. The second tip is bleeding. When you see bleeding, you should always act. Let's start with minor bleeding. First, clean the area with clean water. You don't need to use soap, lotion, alcohol, or iodine directly inside the wound that can irritate the tissue. In some cases, yes, but in most cases, it's not needed. Those are more useful around the wound, not inside. With water, you should physically remove dirt, sand, or visible debris from the area. Do this gently. If you have running water, that's perfect. But pouring water from a bottle also works. You can use your fingers to help, but avoid scrubbing. Scrubbing can damage tissue and slow healing. After cleaning, the next step is to stop the bleeding. Apply steady, direct pressure with a clean cloth, bandage, or even your hand if that's all you have. Hold the pressure for 1 to 2 minutes for small wounds. No need to check constantly, just maintain pressure to let the clot form. Once the bleeding has stopped completely, cover the area with a clean bandage or cloth. Make the bandage snug, tight enough to protect, but not so tight it cuts off circulation. You can check fingers or toes below the bandage. If they turn cold, pale, or blue, it's too tight, loosen it slightly. Next question, do you need antibiotics? You can use them, but not inside the wound itself. Apply a thin layer of ointment like bacitracin or neomycin around the wound. Inside the wound, ointments can interfere with natural clotting, but around the wound, they help create a barrier and lower infection risk. How to guess if a wound is contaminated? Look for visible dirt, small particles, sand, rust, or plant material inside the wound. If you see them, clean them gently. But if particles are stuck and you can't remove them, the wound has a higher infection risk and may need medical care. Deep cuts from rusty objects, dirty knives, or animal bites are higher risk. In those cases, using iodine or diluted antiseptic inside the wound may help, even though it can cause irritation. After that, apply ointment again and change the bandage once or twice a day. Keep the area clean. Avoid moisture buildup that promotes bacteria. Watch for signs of infection like redness, swelling, warmth, or pus. Do you need oral antibiotics? You only need them if signs of infection appear, a redness spreading beyond the wound edge, increasing swelling, warmth, pus, or fever. In clean, minor wounds, oral antibiotics are not required. But in contaminated, deep, or infected wounds, they can be life-saving, especially in remote situations with no quick access to care. If the wound stays clean, no increasing redness, and you see a scab forming naturally, you can slowly reduce dressing changes. Once the skin is healing well, you can leave it uncovered. From antibiotics, most commonly used ones are amoxicillin clavulanate, usually 875 mg twice a day for 7 days. It covers most bacteria, including bite, but not rabies. Or cephalexin, 500 mg 4 times daily, for 5 to 7 days, good for skin infections. If allergy to penicillin, clindamycin, 300 mg 3 to 4 times daily, for 5 to 7 days. When the bleeding is larger, your reaction must be faster, more focused. You don't waste time. First, you check the source. If blood flows fast, steadily, or pours heavily, this is more than minor bleeding. You immediately apply firm, direct pressure to the wound with anything clean, cloth, clothing, even your bare hand if nothing else is there. You hold pressure steady. You don't keep lifting to check every few seconds, that only restarts the bleeding. You hold, for minutes, until it slows or stops. Now, for deeper cuts, wide open skin, or continuous heavy flow, after you control bleeding with pressure, you apply a tight bandage to hold it. Tight enough to compress the wound, but not so tight that fingers or toes beyond the injury turn cold or blue. You keep monitoring, warmth and color mean circulation is okay. If the bleeding refuses to stop, especially if blood spurts or pulses out, that means likely an artery is cut. That's critical, because people can bleed to death in under 5 minutes from major arteries. At this case, you apply maximum pressure. If you know how and have the material, you place a tourniquet above the wound, closer to the torso, tight enough to completely stop the bleeding. You must remember the time. A tourniquet left too long risks tissue death, but without it, the person may bleed out in minutes. Tourniquet can safely stay for about 1 to 2 hours. Beyond that, limb damage risk grows, nerves, vessels, tissues lose oxygen, and the limb may not survive. But the priority is always life over limb. You can survive without a leg. You don't survive massive blood loss. If no medical help is possible within those 1 to 2 hours, and you must leave the tourniquet longer, it stays tight. Even if tissue damage happens, the tourniquet remains if bleeding restarts when loosened. Only if bleeding is fully under control, wound packed, firm bandage applied, no active blood loss, you can attempt to loosen a tourniquet carefully. You release it slowly, watching the wound. If bleeding returns, you retighten immediately. If you don't have a tourniquet, you still have ways to act, but you must be fast and focused. First, you apply direct pressure on the wound, as hard as you can. Use anything clean, a cloth, your clothing, even your bare hands if needed. You press firmly and continuously. If blood soaks through, you add more cloth on top. You never remove the first layer, it protects the forming clot. If you're alone or have minimal supplies, you must improvise a tourniquet. You look for anything strong, a belt, scarf, rope, even a piece of fabric twisted into a strap. You place it above the wound, always closer to the heart than the injury. If it's an arm or leg, place it about 10 to 15 centimeters above the wound, never over a joint. You tie it tight with a basic knot, then insert something solid, a stick, spoon, screwdriver, anything rigid, into the knot. You twist this object to tighten the pressure more. You keep twisting until the bleeding completely stops. Yes, it's painful, but it can save a life. You then secure the stick in place so it doesn't unwind. If you truly have nothing for a tourniquet, your only option is to maintain direct pressure with your hands, non-stop, even for hours if necessary. In some cases, you can also compress a main artery higher up the limb. For example, if it's a leg injury, press hard into the groin area where the femoral artery passes, that reduces blood flow to the leg. Now let's say for a nosebleeds, different, but common. First, no panic. You sit the person down, leaning slightly forward. You never tilt the head back, that sends blood down the throat, risks choking or vomiting. You pinch the soft part of the nose, the fleshy area below the bony bridge, with steady pressure for at least 10 to 15 minutes. You don't release every few seconds to check. Continuous pressure lets clots form. If available, cold compress on the back of the neck or nose can help constrict vessels. If the nosebleed stops, the person rests, avoids blowing the nose for hours. If it continues beyond 20 minutes or blood flows heavily, medical help is required, but in survival settings, you repeat pressure cycles, keeping the head tilted forward. Never stuff cotton, paper, or tissues deep into the nostril, that irritates the vessels more. Just controlled, steady pressure. That's how